Hello everyone. Today let's get started on our next vaccine, that is our meningococcal vaccine. So starting off with the introduction in a meningococcal vaccine, this meningococcal disease is caused by our gram-negative organism. Everybody knows it. It is Neisseria meningitidis. This Neisseria meningitidis is a gram-negative with a diplococcus and it has a polysaccharide capsule surrounding it. So in a population, that is around 10% of the population can have this meningococci as a commensal organism in their upper respiratory tract. Next point, the spectrum of your meningococcal disease ranges from meningitis. I'll write it here. It ranges from meningitis, septicemia, pneumonia, myocarditis, arthritis and conjunctivitis, and it can finally also result in a severe cases, it can also result in shock. It is called as your Waterhouse-Friderichsen syndrome, which has a very high mortality. So the shock that is called as Waterhouse-Friderichsen syndrome, which has a very high mortality. So that this meningococcal disease, that is a very severe meningococcal disease, has a high case fatality rate. The high case fatality rate ranges from 5 to 15%. So severe meningococcal disease will have a high case fatality rate which ranges from 5 to 15%. Right? Yes. Next, there are around 13 serogroups. So in this Neisseria meningitidis have a 13 serogroups. So among these 13 serogroups, there are 5 important serogroups, or 90% of the disease causing serogroups belongs to A, B, C, Y and W135. So these are the most important serogroups. So among these A, B, C, Y and W135, your serogroup A is a cause for your major epidemic. So cause for major epidemic is your serogroup A. Right? Yes. There are outbreaks in this meningococcal disease. So what is the meaning of outbreak in a meningococcal disease? So when 3 or more cases of meningococcal disease occur in a 3-month period in the same locality, it is called as your outbreak. That is 3 or more cases. So when there are 3 or more cases of your meningococcal disease occurring in 3-month period in a same locality, right? So that is accounting to, so which is accounting to 10 cases. So which is accounting to 10 cases per 1 lakh persons. So which is accounting to 10 cases per 1 lakh person suffering from that disease is called as, that situation is called as an outbreak. So these outbreaks are more common in northern areas, that is in a temperate northern areas where there are dry and temperature is low. There is an increased prevalence of this outbreak. So important factors contributing to this major outbreaks are your overcrowding, suitable climatic condition and vulnerability to importation of your new strain. So vulnerability for a new strain, overcrowding and a suitable climatic condition, these are the most important factors that is contributing to your outbreak. So the endemic region, in endemic region, the most endemic age group is between 3 months to 12 months. So the endemic age group or endemicity is more common. So you to put it in another way, so endemicity of this meningococcal disease is more common in infants between 3 months to 12 months, whereas epidemic is all is shift is noted from young children to adolescents. So in epidemic, during epidemic, there is a shift that is noted from young children to adolescents. Okay. So these are the main introduction points you need to know about your meningococcal disease. So another important point is, in India, this meningitis caused by Neisseria meningitidis is the third most common cause of your meningitis. So in India, so this is the third most common cause of meningitis in children. Okay, first most common cause is by your streptococcal pneumonia, second is by your H influenza, third is due to your Neisseria meningococcus. Okay, so these are the most important point you need to know about your meningococcal disease in your introduction. So going to the topic proper, coming to the vaccines, we have two types of vaccines. First one is your polysaccharide vaccine and we have conjugate vaccine. So among your polysaccharide vaccine, we have two. One is your quadrivalent, another one is your bivalent. What does this quadrivalent constitute? So this quadrivalent has serogroup A, C, Y and W135, whereas your bivalent has A and C serogroups. So this both, whether it is quadrivalent or this bivalent, they contain 50 microgram of each of this individual polysaccharides. So they contain 50 micrograms of each of individual polysaccharides, right? Yes. So what is their storage temperature? Storage is between around 2 to 8 degrees Celsius. Dosage is 0.5 ml. Route is either by intramuscular or by your subcutaneous route. So the main thing you need to know about your polysaccharide vaccine is it is a T cell independent vaccine, like other polysaccharide vaccines only. It is also a T cell independent vaccine. Since it is a T cell independent vaccine, they do not have a immunological memory. So they do not induce immunological memory. So these are these are not required for the children less than 2 years of age. So they do not respond in children less than 2 years of age. So the recommended age group. So recommended age group for vaccination with your polysaccharide vaccine are more than 2 years. In less than 2 years, they have a poor immunological response. So these are not used in the children who are less than 2 years of age. The protective, once you give your polysaccharide vaccine, the protective antibody levels are achieved within 10 to 14 days of your vaccination. So protective antibody level. So protective antibody level are achieved within 10 to 14 days of vaccination, right? Yes. So these next recommended. These are mainly recommended for the regions which are endemic for your meningococcus, for travelers to epidemic areas, for household contacts, and for the military recruits. So actually this meningococcal vaccine is not routinely being given to your children. So these are main recommendations are for. So these are mainly recommended for persons in the region of endemic area, to the travelers to the epidemic areas, household contact, and to your military recruits. Okay, so these are the main points about your polysaccharide vaccine. Next, coming to your conjugate vaccine. So among conjugate vaccine also you have two types. One is your quadrivalent, another one is your monovalent. This monovalent, it contains the serogroup of A. Okay, conjugate vaccine, it contains quadrivalent vaccine, it contains serogroup of A, C, Y and W135, right? Yes. So what is being conjugated with the with these serogroups? That is the main point here. So the constituents here are 4 microgram. So 4 microgram each of A, C, Y and W135 which has been conjugated with the diphtheria toxoid. Okay, this diphtheria toxoid level is around 48 microgram. So 4 microgram of your A, C, Y and 135 which has been conjugated with your diphtheria toxoid which is around 48 microgram, right? Yes. So dosage of this quadrivalent is again it is 0.5 ml. Route is by IM. Age group is between 2 to 55 years of age. But this our IAP and ACVAP has recommended a 2-dose schedule for use in children less than 2 years of age. So 2-dose schedule in less than 2 years of age, that is for use in children between 9 to 23 months. Okay, the side effects contributing to your quadrivalent conjugate vaccine are minor side effects are like pain and swelling in the local site. Another one is your GBS. GBS is a unproven one, so possible but in an unproven risk factor given to your meningococcal conjugate vaccine. Next, moving on to your monovalent, that is your serogroup A. So here you have your carrier protein or it is being conjugated with. So the carrier protein here in monovalent is your tetanus toxoid. Okay, so it is the constituents are it is 10 microgram of your serogroup A and 10 to 33 microgram of your tetanus toxoid, right? So this is the constituent of your monovalent meningococcal conjugate vaccine. Route you give it through IM route. Age group is between 1 to 29 years. So here age group is 1 to 29 years, while in a conjugate vaccine it is quadrivalent conjugate vaccine it is 2 to 55 years. And it is given as a single dose, right? So these are the main points regarding your conjugate monovalent serogroup A vaccine. Next, it has an interaction with your PCV13 vaccine. That is your pneumococcal conjugate vaccine 13. So when both your meningococcal conjugate and your pneumococcal conjugate vaccine are given together, there is a decreased immune response. So there will be a decreased immune response when to your pneumococcal conjugate vaccine when these both are given together. Okay, so that there should be a 1 month gap interval. So there should be a 1 month gap interval is necessary between these two groups. So between your meningococcal conjugate vaccine and your pneumococcal conjugate vaccine. So among these meningococcal and pneumococcal, this PCV13 should be given first. So this is given first, then followed by your meningococcal conjugate vaccine. Okay, this is another important point to be noted. Next, recommendations according to your IAP. So since your meningococcal vaccine is not a routine vaccine in India, first point, it is not a routine vaccine in India. It has a special situations, but we have a special situations in which we need to give your meningococcal vaccine. So in this, during the outbreaks, conjugate vaccines are being preferred. So particularly for your meningococcal A disease, we prefer a monovalent vaccine. So monovalent conjugate vaccine is mostly preferred during outbreak because most of the outbreaks or major epidemic are caused by your serogroup A. Next, coming to the high risk conditions, like first, when the child or a person who is having a terminal complement component deficiency. In a child with a terminal complement component deficiency, the vaccine preferred here is meningococcal conjugate vaccine. Schedule is your 2-dose primary series. The age group is The age group recommended is between 2 years till 55 years. So coming to this 2-dose schedule, the second dose is given 8 to 12 weeks after the first dose. So second dose is given 8 to 12 weeks after the first dose. Booster dose should be given every 5 years. So the revaccination should be done every 5 years. This is for a patient with a terminal complement component deficiency. Coming to a child or a person with functional or anatomic asplenia or a hyposplenia, for this person, again, it is vaccine preferred is your meningococcal conjugate vaccine. Here it is also a 2-dose series, 2-dose schedule, where second vaccine is given 8 weeks after your first dose. Recommended age is between 2 years to 55 years, but the ideal period for vaccination, so ideal period for vaccination in this persons, that is while doing your splenectomy, so ideal period for vaccination is started 2 weeks prior to splenectomy. So this is 2 weeks prior to, when you are planning for a splenectomy, so 2 weeks prior to splenectomy you should give your meningococcal conjugate vaccine. Alright, yes. Next, coming to a next important category, that is in a lab personnel or in a healthcare workers. So vaccine preferred here is meningococcal conjugate. Schedule is a single dose schedule should be given. Booster dose is again every 5 years once if the person is undergoing a ongoing exposure. So booster doses every 5 years if there is a exposure is ongoing. Right. So this is for lab personnel and healthcare workers. Next, for travelers who are being who's planned to travel to Mecca. So for that person, you will be giving a meningococcal conjugate vaccine, which is an IM dose. Route of vaccination is intramuscular. Next, dose is 0.5 ml. Age group is between 2 to 55 years of age. It is a single dose. So single dose is for your traveler and for the lab personnel and healthcare workers. These are mainly travelers to Mecca. Right? Yes. Here meningococcal conjugate vaccine, among this monovalent and quadrivalent, here they prefer a quadrivalent vaccine. Why they prefer quadrivalent vaccine is there is being outbreak in this Mecca pilgrimage with serogroup A and W135, so that they prefer a quadrivalent meningococcal conjugate vaccine. Okay, so these are the most important point that you need to remember for your meningococcal vaccine. So just I'm doing a brief for you about your meningococcal vaccines. Are you have, don't get confused, there are only two vaccines, one is polysaccharide and another one is conjugate. In polysaccharide you have quadrivalent, another one is bivalent. In quadrivalent you have A, C, Y and W135, while in bivalent you have A and C. Okay, coming to your conjugate vaccine, here also you have two, one is quadrivalent, another one is your monovalent. Quadrivalent is again A, C, Y, W135. In monovalent you have serogroup A. Why they prefer serogroup A is it causes a major epidemic outbreak, so that they prefer a monovalent serogroup A conjugate vaccine. So these are the important point you have to remember regarding your meningococcal vaccine. Yes, thank you. From next video we'll start from our BCG vaccine, that is from our birth vaccine. So next video will be about BCG. We'll go from our birth vaccine. So first will be our BCG, next we'll go from our oral polio vaccine and hepatitis B vaccine. So we'll cover these three vaccine in our upcoming video. Thank you for your patient listening. Please like, share and subscribe our YouTube channel, and let's all learn our pediatric together. Thank you.